Need for nurses is continually growing in the country. So much the Bureau of Labor says from 2016 to 2026, the expected growth is by 15%. That's compared to 7% growth across all occupations. The Greater Lafayette area and Purdue University are working together to stay ahead of the curve. I'll show you how.
What we're looking at is nurses who can meet the needs of the community.
Dr. Nancy Edwards says to meet those needs, Purdue has decided to accept more applicants. Typically 1,400 students apply and around 100 are accepted. But back in 2016, the School of Nursing pushed that number up to 200. 200 nurses who need to be multifaceted.
Nurses who have not only the technical skills they need in nursing, but also what we call the soft skills.
It's the art of nursing, showing compassion, being a good listener, and having a steady work ethic. Even with all of that,
by 2030, the RNs would increase from 28% from 2.8 to 3.6 million.
The nursing shortage is intensifying due to the age of baby boomers. More than 1 million registered nurses will retire in the year 2030. And here at Purdue University's nursing school, it's doing everything it can to combat that.
We're going into public health, community health, rural health. We're in all the areas now, not just in the hospital.
Being a nurse is so much more than it used to be with the expansion of healthcare. The growth of opportunities has contributed to the nursing shortage, and RNs and students experience that firsthand.
I didn't really realize it before I started working, but once you start working, you definitely feel the effects of having low staffing numbers that affects you personally as a nurse and then eventually affects patients too.
You do feel those effects. And I think our patients feel those effects as well.
The effects will keep piling on, but Purdue and community partners are striving to do the best they can. The American Association of Colleges of Nursing reported baccalaureate nursing programs increased by 3.7% back in 2018.